For nearly 30 years, the American Academy of Hospice and Palliative Medicine has been the only national medical specialty society for hospice and palliative medicine professionals. Today, more than ever, we are committed to improving the care of patients with serious illness by expanding access to high-quality palliative care. There is no better time to be involved in your academy. AAHPM serves as the primary source of information, engagement, and education for nearly 5,000 physicians who practice hospice and palliative medicine, and we support other healthcare professionals in a variety of settings. Member input is vital in shaping the Academy. In 2015, we conducted a survey to see what was on their minds. 92% said they are highly satisfied and committed to the Academy. 1 in 3 participants in AAHPM communities and more than 200 serve on committees and task forces. Ours is one of the most active and visible medical specialties on social media. Thousands of members participate on Twitter, Facebook, and LinkedIn. And this year, more than 2,200 members are actively engaged on the Academy's new Connect platform. And the Academy's websites serve as excellent resources for clinicians and patients, with nearly 500,000 total visits each year. We are also committed to creating a welcoming environment for all our members through our diversity and inclusion initiatives. We offer an expanded array of live and virtual learning opportunities, all designed to increase effective practice. In 2015, 3,000 people from nearly 24 countries attended the AAHPM and Hospice and Palliative Nurses Association Annual Assembly in Philadelphia, and more than 350 attended the first-ever Summer Institute featuring 4 intensive courses. We also collaborated with several other healthcare organizations to develop and deliver quality educational programming throughout the year. As part of the collaboration for REMS education, 44,000 prescribers and other learners have completed REMS education since 2013. Members also benefited from discounts on popular and valued print, audio, and electronic offerings. Nearly 100,000 in scholarships were awarded to physicians in the United States and from developing countries for education, presentation support, and mentoring opportunities. The Academy is committed to supporting our growing workforce, including clinicians, educators, and researchers, in order to expand access to hospice and palliative care. The workforce metrics we monitor show that as of 2015, nearly 7,000 physicians were certified in hospice and palliative medicine. In addition, 509 are certified by the Hospice Medical Director Certification Board. We are partnering with George Washington University's Workforce Study Center to collect postgraduate job data and to conduct trend analysis across settings. Numerous fellowship training initiatives also receive our support. In 2015, Hospice and Palliative Medicine entered the National Resident Matching Program Specialties Matching Service. It was exciting to see that 97% of programs participated and 280 funded positions were included, and on match day, more than 80% of the positions were filled. AAHPM also continues our work to develop reporting and curricular milestones. In addition, we have secured and distributed more than $2 million in fellowship grants to programs throughout the United States over the past 5 years. Leadership and career development are promoted through our initiative training, coaching, and mentoring programs. Year-long scholarships provide funding for new mentoring relationships. The AAHPM Leadership Forum, delivered in partnership with the American Association for Physician Leadership, has brought together more than 160 physicians since its inception in 2014. In response to the rapid growth in hospice and palliative care, the Academy brings together national leaders to promote quality and reduce variation in patient care. A key initiative is Measuring What Matters, where we work with other national organizations and thought leaders to ensure that meaningful measurements and benchmarks are used for quality reporting. We also facilitate the translation and application of research and quality data into clinical practice. Our Journal of Pain and Symptom Management is an internationally respected, peer-reviewed scientific journal. Each month, it publishes the latest clinical research related to the relief of illness burden among patients with serious illness. Finally, the annual Kathleen Foley Research Retreat, supported by the Academy for nearly a decade, has assembled hundreds of researchers, including junior faculty and trainees, to encourage mentoring, collaboration, and networking. AAHPM promotes the value of hospice and palliative medicine to patients and families, policymakers, and payers. Together with our members, we advocate for policies that recognize and support the needs of patients and the health professionals who care for them. This year, the Academy advocated for expansion of the Palliative Care and Hospice Education and Training Act, adding new provisions to grow the nursing workforce, improve patient and provider awareness, and increase research funding. The bill, commonly known as PACHITA, was reintroduced in the 114th Congress with bipartisan support. During our most recent Capitol Hill days, Academy leaders met with congressional offices to urge support for the legislation and held meetings with key staff for the Senate Finance Committee Chronic Care Working Group and the Centers for Medicare and Medicaid Innovation. Through its active delegation in the American Medical Association, the Academy has also been able to influence AMA policy to the benefit of our physician members and, most importantly, the patients we serve. We work with specialty societies to help secure the Centers for Medicare and Medicaid Services adoption of CPT codes for advanced care planning. The Academy also weighed in on regulatory matters, including hospice payment, quality reporting, and restrictions on opioid prescribing. The Academy's new strategic plan will help support our members and guide us into the future with focus on engagement, knowledge and competency, workforce and career development, quality of care and evidence-based research, and public awareness and advocacy. Together as a community, let us grow and thrive in the year ahead. Remember, AAHPM is your organization for quality education, practice resources, professional connections, and advocacy support. You're important to us. We thank you for your support. For more information, visit aahpm.org or join us on Twitter, Facebook, or LinkedIn.